Hi, my name is EC. I am a sales specialist, and today I am here at CSA Medical Aesthetics. I have known Dr. Contessa Salvador as one of the best medical aesthetics practitioner here in the Philippines and the owner of CSA Medical Aesthetics. My primary concern is to address my acne scars and at the same time to maintain deep hydration for my skin and also skin tone and surface evenness for my skin. And as Dr. Contessa Salvador recommended to me to use skin boosters to address all of my concerns. Don't forget to click the subscribe button and notification bell to keep you posted.
Good day everyone, welcome to the CSA Medical Aesthetics. I'm Dr. Contessa, your certified aesthetic physician here at the CSA Medical Aesthetics. Today we have a topic on acne scar management. For the first time we have with us Sir EC. Welcome EC.
Good morning, Doc.
Yes, so we'll talk about acne scars, okay? So these are remnants of those problems when we were teenagers, okay? So the age of like 12, 13, and so on, we notice on our face we have some acne, pimples, starting from like blackheads, whiteheads, right, EC?
Yes, Doc.
So when you were like high school, when you had some acne, remember that?
Yes, Doc.
Yeah, and then those were like cystic?
Yes.
Okay, and did you take some oral medications?
I did some, Doc. Yes, I
like
did.
Like isotretinoin?
Yes,
yeah,
Doc.
There you go. And they have souvenirs. Okay. The good thing right now, your face is pimple-free, acne-free. Right, EC?
Yes, Doc.
So the main concern will be just these types of acne scars you have, particularly on the mid-face section. If you look at the face of EC, we're noticing all the acne scars located in the mid-face area, right? And if you do assessment, you'll notice that there are different kinds of acne scars. He has all the types of acne scars. Because we have pitted scars, we have those back scars, undulating scars, rolling scars, ice pick scars. Are you aware of those types of scars, EC?
Mostly,
Different
Doc,
kinds,
yes.
Mostly?
Yes.
Yeah, okay. Because if you assess, like, here at this part, the right side, okay, I can see back scars. I can even see like a rolling, undulating scars and some of the ice pick scars. Now, if we have different kinds of acne scars or different types, we also have different kinds of management. For every type of scar, there's a specific type of a management. Now, I also do an assessment called stretching the skin. Like if I assess the acne scar, I do the so-called stretching the skin. Now, if I see scars that flatten or kind of get elevated, so those sunken scars, they get elevated when you stretch the skin. Those are the so-called stretchable scars, and then we can manage them with like chemical peel or laser peel. But if upon stretching you notice that there is a scar that is still dented or depressed or sunken, so those are your non-stretchable scars, and you may need other types of treatment, like combining it with surgical procedures like punch excision, okay, or the subcision. Subcision and injecting with either like a filler or other polymers, or like your collagen biostimulators, which EC is so familiar with, like your skin boosters, and we have polymers like PLLA, right?
Yes, Doc.
So for Sir EC, you have all the types. Stretchable and non-stretchable. So you're a candidate for chemical peel, laser peel, even those surgical intervention, even the subcision with injection of your skin boosters, or even your polymers. We'll show the procedure when CSA Medical Aesthetics return. And we're back, so we're with EC and we are doing acne scar management, EC, okay? So we'll be doing a combination treatment for EC since a while ago we mentioned that his type of acne scar would require combination procedures, okay? We'll start with devices. The one that we will use for now will be Eladerm. So we have Eladerm, which is a radiofrequency with microneedling. So this one is a device that's also indicated for acne scars, all types of acne scars, of course even other facial scars, okay? And this one has microneedles. And of course when you have microneedles, they kind of insert through the skin dermis, particularly the reticular. So you're passing through the papillary and then the reticular dermis. You want to tap your fibroblast cells to synthesize new collagen. And the radiofrequency emits certain temperature. We want the optimal temperature to be able to induce a so-called neocollagenesis as well. Okay, EC? Now, EC already had also this kind of treatment, right?
Yes, Doc.
So he had 2 sessions of also the radiofrequency microneedling. So since he has already 2 sessions, meaning to say his skin condition had already improved, right? So like how many percent EC was the improvement already?
I think, Doc, what I observed, it has improved like 50%.
Estimate.
Doc.
Okay,
Ano,
yeah,
estimate?
50% already. Okay, so we could probably check on his old photos how deep those atrophic acne scars are. Okay, so since this is your 3rd session already, so for every treatment we can say like a 20-ish% improvement, right?
Yes, Doc.
So this is the 3rd one. So 50% plus 20 to 25%, 75% improvement already, okay? And we will add another treatment for EC, okay, to target those non-stretchable scars. So I have my device. I'll be starting with my Eladerm. So you've seen me doing this Eladerm. We'll just continue full face treatment for Sir EC, okay? So I have my tip already. Okay, starting on the forehead, okay? So we're on our final shots on the nasal skin area. Okay, we will be proceeding to the so-called subcision with our dermal filler, and we'll be using specifically our skin boosters, the so-called Restylane Vital Light for Sir EC. So Sir EC had already, this is a 3rd RFMN session for Sir EC. He also had an experience on subcision with skin boosters in the past. About a year ago, Sir EC?
Yes, Doc.
Yeah, okay. So after a year, we can do a repeat of this subcision treatment using our skin boosters, so hyaluronic dermal filler, specifically our Restylane skin boosters, okay? So since our concern is basically mid-face section, right? So upper to lower cheek, okay? We'll work on this part. Then I'll be adding a so-called like another hyaluronic filler like our Restylane Classic to kind of also do like a lifting method to stretch the skin further, okay? So I'll start on the right side here. So disinfect the area, clean the area first. Okay, so it's expected when you do your radiofrequency microneedling, you can see some microbleeds there. Okay, so I'll be just doing a so-called cannula method here. I have my entry point here at this aspect. Okay, so I'll be using this cannula gauge 22. Okay, I'll use my cannula just to do the so-called subcision technique. So I'll start gliding this. So ideally, you want to subcise in the dermis layer. Okay, that's the ideal method, okay, and also a portion of your subdermis, okay. So I'll be doing is kind of like a maneuver whereby I am kind of moving through those fibrotic layers, okay, and separating any adhesions of your, for example, your dented scar, your atrophic scar. So it is adhered to the layer beneath it. So we want to separate that adhesion, okay? So you see, you're still good?
Yes, Doc.
So I'm just doing this first, maneuver first, and then it's kind of creating a space for my hyaluronic filler here, like my skin booster, like your Vital Light, where I will be placing them. You're creating that layer, okay? So I'm just preparing the tissue layer where I will push my product filler. You're still good, EC?
Yes, Doc.
So there you go. So EC is already reporting a 50% improvement of his acne scars. since he had done already in the past procedures. A combination of radiofrequency with microneedling, also your subcision with your dermal filler like your skin boosters, okay? So there you go, I'll start pushing with my product right now. So this technique is called a fanning technique, okay? So I'm still feeling some of the fibrotic scars there, so I'll still kind of continue with this subcision on this side here, okay? So once I have a good smooth space here, I can already push my product, okay? So it's tolerable, easy?
Yes, Doc.
So one line there, and then I'm gonna go to the other direction again. So this is a cannula method. You can actually do a serial puncture technique, like one by one you inject beneath the scars. So we can do a combination of that one too, okay? We'll also be doing the one by one injecting the scars. So I'll be using one syringe on this side, one syringe on the other side. Then I'll be combining with a classic of my Restylane, okay? So this is a so-called cannula method. For like using needle to subcise, you can actually use your gauge 18, gauge 19 to subcise. There's a specific needle we call, it's called Nocar needle. So you can use that also for subcision. But Sir EC is so busy, so we just opted to use the cannula, a blunt type of needle, okay? So I'm still doing my pushing of the product here. Plus this skin booster will help also restore skin glow, skin hydration. There you go. So you'll benefit from this one. And then they were reporting also that with hyaluronic injections, you're kind of also stimulating neocollagenesis, neoelastogenesis, so skin tightening, firming, and all improvements of skin quality will be there. Right, sir?
Yes, Doc.
Yeah. So glowing of skin, radiance, those are the one that we want to improve. The quality of the skin, of course. The radiance, the glow, the luminosity, hydration, okay? So we don't want to have dry skin or dull skin, rough skin. We want to have just smooth and clear skin, okay? Good thing that Sir EC already is not experiencing active acne. Good thing you don't have any more acne problem.
Oh, nga,
So
Doc.
that's another kind of like management that we will need to do, because some of my patients, they have acne scars. At the same time, they have active acne lesions. So for cases like that, so we manage first the active acne, the inflamed acne. You can like do oral medications for those moderate to severe acne problems, acne vulgaris. Now there's a question like, when can you start managing the acne scars if your patient has active acne? Actually, there's a study saying you can already start managing acne scars together with your therapy or treatment of your acne vulgaris, active acne vulgaris. So you can start right away. So they've done studies on that already. So even if Sir Easy here still experience some like a pimple, right, Sir Easy? Sometimes you experience pa rin.
Sometimes, Doc, yes.
From stress.
From stress.
Okay, so I'll do a combination. I'll use a needle method also. So we have 3 syringes of your skin boosters, right? So for my other syringe, there's a so-called needle method. So what you're gonna do is just like making a papule technique here. So I still have like remaining acne lesions. Just do papule technique. Yeah, just make some tiny blebs there on the lesions that are still sunken. Okay, you can do this combination procedure. Again, for different types of acne scars, we have different types of management, okay? It's not a monotherapy for all kinds of acne scars. So for our patients, when they're asking me like how much is the management or the treatment, how much is the medicine or the therapy, it will depend on the type of acne scars you have, okay? Now, the earlier the acne scars, the earlier you treat it, the better. Just don't wait for it to become so fibrotic. Treat it right away, okay? So when you experience acne, active acne, and it left a mark or like an indentation or it's a trophic scar, so do your management as soon as possible, okay? So I'll proceed with my Restylane Classic. I want to do a so-called lifting method using the same entry point So I'll use half ml of this, then we'll proceed to the opposite side. You're still good, sir?
All good,
Okay.
Doc.
So this part here, so turn to the other side po. Thank you so much. So kind of some adhesions there. So we want to do a so-called lifting technique with this filler hyaluronic substance that we have. We can place some substance on the posterior aspect of the face. This is the non-mobile zone of the face. So you want to strengthen that, make that firmer. Because this part is the mobile zone. So we want to create some good volume here. Especially for those individuals who already experience some subzygoma depression there. Okay, you're still good?
All good, Doc.
Thank you. So you can reach up to the zygoma region there. So sir, easy in the future we can do some masculinization of the face, contouring into a more macho face, right?
Yes, Doc.
Yeah, that's our next goal. Because Sir Easy kind of looks baby face. Still with baby fats. Sir Easy. How young are you, Sir Easy?
I'm already 37, Doc.
Ah, but you look young, huh?
Thanks, Doc.
No stress?
A lot of stress.
A lot of stress, but you're able to manage it.
I'm
So
able to manage it naman,
yeah,
Doc.
let me just go on to the angle of the mandible there, just to create that good tightening and firming. So actually, he's a candidate also for improving the jawline, creating a jawline there for a masculine, more masculine look. Because Sir Easy mentioned he has round face, right?
Yes, Doc.
So we can make it square shaped face. Make it more angled. Okay, so I've done the right side. Let's proceed to the opposite side. So we have done a combination procedures for the acne scar management. We did the Eladerm, we did also the skin boosters together with Subcision, and some of the lifting technique with our Restylane Classic. We'll show the result when CSA Medical Aesthetics return. And we're back. Let's show the result to Easy. Easy, here's the mirror. So for now, there will be a temporary redness of the skin because we had multiple injections there. The Eladerm also is like multiple microneedles there. So you'll expect erythema or redness and some like kind of pinpoint swelling there, or the so-called what we call like cutaneous edema or follicular edema, whatever. So it's temporary. You have some papules there because of the needle method we did with our skin boosters to just elevate those sunken scars. How was the experience, or Easy?
It's actually good, Doc.
Tolerable.
And tolerable,
Yeah.
yes.
Did you feel those microneedles with the Eladerm?
Actually, Doc, because
You had an anesthesia.
I had an anesthesia,
Yeah,
so
it was numb. So you don't even
I
feel
don't
the
even feel.
micropins from your Eladerm. And the Eladerm, we had the suction type of your tip, because we have two types of Eladerm tips, the cryo tip plus the vacuum or the suction type of tip. So we use the vacuum type to really elevate the skin and really have that good penetration of your microneedles into your reticular dermis, because we really want to stimulate those senescent fibroblast cells, or the fibroblasts that will stimulate, or the fibroblasts that will form your new collagen and elastin, as well as your hyaluronic glycosaminoglycans. So with the skin boosters, we did the Subcision, but I used the cannula. Ideally with Subcision, we use the sharp needle, okay, but I know EC still has work, okay? He doesn't kind of like have like time for a long, long recovery time. Because when we use the knocker needle for Subcision, you'll really expect a lot of swelling there. There will be more bleeding, there will be more swelling and like kind of bruising there. So I just use my cannula, which is gauge 22, and together with that, injected the skin booster, your Vitalite hyaluronic substance. It is a low molecular weight hyaluronic substance, and we inject it beneath those sunken acne scars or your depressed or atrophic scars, okay? Because the goal is to really separate the tethering band, the fibrotic band, from pulling those scars inwards. So you cut them, you subcise, and then create a space, and then you fill in with your like hyaluronic. You can even use other substances, other polymers, like your polynucleotide. You can even use polylactic or polycaprolactone or polydioxanone just to fill in that space that you've created after you do your subcision, okay? And the newer the scar is, and you treat it earlier, the better, the more improvement, much skin quality improvement, okay? And in addition to that, right now, if you still have like active acne lesions and you have your acne scars and you want to manage both at the same time, so there are already reports, studies saying that it is safe to combine, like for example, you're on oral isotretinoin and you want to start treating your acne scars, you can already combine with treatment modalities for your acne scars. There you go. So I hope there was an additional information there. Okay, thank you, EC. Okay,
Thank you so much, doctor.
so we'll see more of EC. We'll have follow-ups on him. So this kind of procedure, it's not just a one-time treatment, okay? So we do sessions, we do like different visits for this kind of acne scar management, because your acne scar didn't develop just like an overnight, or it didn't happen just in few days or few weeks, okay? It happened for a long period of time. Like you had your acne when you were high school. Now you are 37.
7, doc.
So it was an old acne scar already, and we're managing it right now. And of course, there's a lot of fibrosis there. So we need multiple treatments, multiple sessions. And the number of sessions will also depend on how severe the problem is, how old the problem is, okay? So some people, 2 to 3 treatments, they're okay. Others 3 to 6, others 6 to 8, others 8 to 10, or 10, more than 10, 20-ish. It depends, okay? And also it will depend on the response of your tissues. If your tissues have active cells or healthy cells, and you have healthy lifestyle, okay? So those factors will also matter, okay? So dependent on the person who's receiving the treatment, how good your tissues are in responding to our treatments. Also on the doctor, the physician doing the procedures, and the kind of product that we are using. Thank you, EC.
Thank you so much, Dr. Contessa.
Yeah, we'll see more of you. We'll show to our audience like how was the improvement. 2 weeks, 4 weeks, okay?
Yes, doc.
There you go. Do you have any social media that they could follow you?
I'm actually more active on Instagram.
Instagram,
Yes,
okay,
doc.
yeah, Instagram.
At EM_3_887. So actually, thank you so much, Dr.
Yeah,
Contessa.
you're welcome.
I'm very much excited to see more of the results, and do visit CSA
Yes,
Medical
thank
Aesthetics, and just trust the process.
Trust the process. I love that statement. Okay, so if you have any questions, you may email us at csaskinclinic@yahoo.com, our FB page, CSA Medical Aesthetics, Instagram, CSA Medical Aesthetics. Our clinic is located here at the Infinity Shop, Pulong Maragol, Angeles City. Contact number 0933-860-9193 or 0917-504-4268. And please do watch our other videos at our YouTube channel, Contessa Salvador. So God bless you all. When it comes to natural beauty, you can trust the CSA Medical Aesthetics.